Well, good afternoon, everyone. Thank you so much for joining our Utah Rare Disease Day event. And I'm just going to give it 5 more seconds as we let everyone else in from the waiting room. And we will get everything underway. So to kick off today, we have 2 videos that we would like to share with you all. And as just a little bit of housekeeping, if everyone can make sure that they're on mute today, if you're not speaking. And then we noticed that with bandwidth for these videos, sometimes if you turn off your camera just for the duration of the video, and then we welcome you to turn it back on for the rest of our presentation, that might help a little bit too. But we will get those videos started, and thanks again for joining us today.
I am Tristan.
Angelina.
Nama saya Syafiq. Regina.
Habari asubuhi, Javi.
Jeg Christian og jeg bor i Norge.
I live in the United States of America.
In Australia.
Malaysia. No Brasil.
Tunaishi, Kenya.
My passion is for fashion and design.
I love to dance.
Menyusur hutan. Para viajar e descobrir novas culturas.
Anapenda kunitazama nikipuliza mapovu.
Jeg elsker idrett og spiller spill med familien min.
Minhas paixões são minha fuga quando as coisas estão difíceis. Ada hari-harinya apabila melakukan perkara yang biasa akan jadi sangat susah.
When your disease makes you feel isolated.
It's difficult to walk.
Å være med på laget.
When I'm tired.
Afraid.
O controle da doença pode ser desafiador atau mengecewakan bila saya kehilangan masa.
Muda muhimu sana.
But we learned to be resilient.
Para apreciar os pequenos detalhes que me trazem alegria.
Kumuona mtoto wangu wa kiume anavyofurahi tunapoenda nje, nikijua anasikiza hadithi na sauti zilizo karibu.
Mencari titik perhubungan dengan masyarakat yang tak pernah saya sedar wujud.
Å være uavhengig på grunn av menneskene rundt meg.
Their fierce support.
Sua bondade inabalável.
Their big love.
Mine venner,
Keluarga, enfermeiras,
Doctors.
Support workers.
assistenter,
Mashirika ya wagonjwa.
Together, we are a strong community.
Nimeweza kuelekewa.
histórias compartilhadas que me libertaram das dúvidas.
og ga meg selvtillit.
I am Tristan. I live with sickle cell.
I'm Angelina.
And she has CASC, a neurological disorder. Saya Syafiq dan saya hidup dengan ectodermal dysplasia. Regina, eu tinha leiomiosarcoma, câncer raro.
Huyu ni Harvey. Ana SMA, spinal muscular atrophy.
Christian og jeg har UI, medfødt benskjørhet.
Esta é minha vida, suara saya.
And I am more than my disease.
We are rare.
Kami ramai, nós somos fortes.
And we are proud.
And then we have one more video real quick.
Welcome. I'm Peter Saltonstall, President and CEO of the National Organization for Rare Disorders, and would like to welcome you to our 2021 Virtual Rare Disease Day event. But before we begin, I'd like to send out a special thank you to all those advocates and others who have spent so much energy and time supporting the rare disease community. So thank you. The role of Rare Disease Day is to bring together advocates and patients from around the world to help tell the story about rare diseases. There are events like this happening virtually all over this country today. And some of the audiences that we're really trying to focus on are those in the state legislatures, where advocates and legislative people come together to understand the burden of rare diseases and the impacts it can have on them, and therefore build the appropriate legislation and pathway to make sure that bills are passed that support rare disease patients. As a matter of fact, NORD's doing that in a very focused way with rare disease advisory councils. We've got them set up down in 16 states and are building them in others. I think 2021 is going to be an interesting year for us. The reason I say that is because we've just come off of a very difficult year with a pandemic that's impacted the rare disease community in a number of different ways and has really shown some of the inequities in the healthcare system. For all of you that are watching today, the importance of the Rare Disease Advisory Councils is critical to the success of being able to communicate the story and the needs of the rare disease patient community. So in conclusion, I would really like to make sure that I recognize and thank all of those sponsors who have helped us make this day a reality. Without your continued support, none of this would happen. So a sincere thank you from all of us at NORD and the patient community. Taking part in events like today's are really important to the rare disease community, and we must always remember that alone we are rare, and together we are strong.
All right, thank you everyone. And I welcome you. If you'd like to turn back on your camera, please feel free to do so. So again, a big welcome to our Utah Rare Disease Day event. Before we begin with our presentation, I did want to do a quick medical and legal disclosure just to let you know that we will not be providing any medical advice today. And we'll drop this disclosure in the chat too. So if you have any questions, feel free to let us know. And with that, I would like to turn it over to our wonderful volunteer state ambassador in Utah, Matt. Take it away, Matt.
Hi guys, thank you for coming today. I hope you enjoyed our 2 videos. We have a lot to bring you today, a couple patient stories, some medical professionals, and other legal legislative talks today. It should be really fun. Later, there will be a small event. So I do encourage you to grab a piece of paper and a pen at any time of your convenience throughout the presentation to be ready towards the end of our talk today. Once again, thank you for being here, and I will turn it back over to Elise.
Thank you, Matt, and good afternoon. As mentioned, my name is Elise Patel, and I serve as the Western Region State Policy Manager for NORD. And we're excited to be here today to talk about NORD's Rare Disease Advisory Council work and share why RDAC started and where we're headed as we move forward this year. So as many of you know, there's currently 25 to 30 million Americans that are impacted by a rare disease, which breaks down to about 1 in 10 individuals. And while that's quite a few people directly impacted by rare diseases, we're finding that many lawmakers aren't necessarily aware of the unique challenges that are faced by the rare disease community. So the solution was to form rare disease advisory councils, where a group of diverse individuals from the rare disease community could come together and advise the state government. And this is especially important because we know that so many of our healthcare decisions are made at the state level. So we see RDACs as an enormous opportunity for the community and legislators to come together and partner in a more strategic way to address issues on a regular basis. The first council was created in 2015 by some of our wonderful advocates in North Carolina, and since then has gained traction across the country. And as you can see from this slide, there are currently 16 states, with Utah as one of them, that have passed RDAC legislation, with Massachusetts being the last state to do so just last month. And much of this progress has really happened over the course of the last 2 years, with 10 governors signing RDAC legislation into law since 2019. At NORD, we launched Project RDAC this past year as a way to help optimize the existing RDACs, as well as help increase the number of RDACs across the country. And under this initiative, NORD is going to be providing opportunities for RDACs to collaborate with each other, as well as providing educational resources to guide RDACs every step of that journey. And I welcome you to visit our website, rarediseases.org, and click on the Project RDAC tab. And I believe Kristen's probably dropping that in the chat right now as well. But there you'll find our resources. We also list our upcoming events, any coalition meetings that are taking place in states, as well as an interactive state map where you can view state-specific information. And like I had mentioned, we're really excited that Utah did pass legislation during their 2020 session to create a Rare Disease Advisory Council in the state. And you're going to hear more about the council later in the presentation, but really this council is a great way for people to advise and make recommendations to the legislature, and also as a way to identify best practices to improve the care and treatment of individuals living in Utah with a rare disease. So recently, we were really pleased to see that the funding for the council was restored in the budget after it was actually rescinded last year as part of the COVID-19 budget cuts. So we're excited to be working on appointments, and hopefully we'll have those begin in the next few months. So we'll have more information on that, but Utah's off to a fantastic start. And then I also wanted to share with you briefly our NORD state report card. So this is our 6th year publishing a state report card. And the report card is a tool to help evaluate how effectively states are serving the rare disease community. It's a way for us to track individual state progress on priority issues as seen on the slide, and enable effective advocacy by providing a tangible tool to see how your state measures up in key areas. The issues outlined touch on several critical and relevant policy areas. However, we understand that there are still other policy areas that impact the lives of rare disease patients. And this year, we actually transitioned to a new interactive digital format. So there's a state report card landing page, as well as a web page for each of the 8 issues highlighted in the report. So feel free to use the link provided on the slide and also in the chat to see how Utah measures up. And I'm going to briefly play a quick demo on how to navigate the report card.
So here we have the landing page for the 6th edition of the NORD State Report Card. We've just got a little intro text up here, and then we have the 8 issues that we assessed in the 6th edition of the report right here. If you go over here, we have a drop-down bar where you can click and select your state. And then right underneath of that, we have all of these patient stories about some of the issues that are focused on in the report card. So now I'm just going to navigate to one of the issue pages. I'm going to click Medicaid financial eligibility, and that'll take you to this individual issue page. We just got a little bit of intro text again at the top, and then some more text about what the issue really is and why NORD cares about it. Underneath, then we have some text about the grading methodology for this section, as well as the rubric, which is available at the bottom, and also underneath of the map right here. Again, we have that drop-down bar where you can select your state. Then if you go to the left over here, you can click and access all of NORD's policy statements on the particular issue. And then you can also click and access the appendix for that section. So next, I'll look at the map a little bit. So you can hover over each state on the map and see the state's overall grade, which is bolded there for this section, as well as the subgrades that were averaged together to get that overall grade. If you click on any of the states, it will take you to that state's individual state report card page. So I clicked on Virginia, and here is Virginia's state report card. If you scroll, you can see that we have all 8 sections and their overall grade up here in orange, and then the subgrades underneath. And you can also click this right here if you want to open a printable version of the individual state report card.
Perfect. So finally, I wanted to just share some of the methodology behind the state report card. All of the data that you'll see on the report is as of November 2020, with the exception of rare disease advisory councils. And we updated the RDACs through December to reflect the exciting passage of RDACs in both Ohio and Massachusetts that happened at the end of the year. And any of the current bills in the state legislature or bills that may have already passed in the beginning of 2021 were not factored into the report card or grade. And as you saw in the demo, each issue has its own appendix that we derive the overall grade from, and each individual state page or issue page contains a grading methodology section where you can read more about how that issue was evaluated. And with that, I welcome you to reach out to our policy team with any questions you have related to our Project RDAC efforts, or also our state report card by emailing policy@rarediseases.org. And I'm going to turn it back to Matt, who will introduce our next speaker. Thank you, everyone.
Hey, everybody. So we have a couple. I am actually going to be my own next speaker. I'm going to share my story briefly. And I just wanted to tell you a little bit about myself just before I begin my little speech. I am 24 years old, graduated from Westminster College in Fulton, Missouri. I moved out to Utah with my family to work at the National Ability Center. And I am an adaptive instructor in the summer and an adaptive snowboard instructor in the winter. I have a sister who also has the same rare disease that I do. And with that, I will start. So, the saying I have heard most in my life is, God never gives you more than you can handle. Well, 2 Fanconi anemia diagnoses, 2 bone marrow transplants, dad's job loss, mom's menopause, insurance nightmares, puberty, college, now 24 and managing a life-threatening disease on my own. How am I doing? I can honestly say that I'm proud that this is my story and I would not change my life. My sister and I are 2 young adults fighting a rare disease just to live and make a difference in this world. However, the odds were not in our favor. In fact, there are only a few other families in the world where where both siblings also survived transplant. And I hope by sharing, it'll make a difference for others here today. I hope to put purpose to the pain. I was born hearing impaired with 1 kidney, hand anomalies, short stature, and bilateral hip dysplasia. My sister Alexandra was born blue, premature, and my mom flatlined at her birth. The doctors almost lost them both. Alex went to NICU immediately for surgeries, and mom came back miraculously too. Alex was tiny, at 4 pounds, 12 ounces. She was also hearing impaired, did not have an anal area, intestinal problems, 1 fused horseshoe-shaped kidney, a non-working hypoplastic thumb on her left hand, a shorter left arm, and probably could never walk, talk, or eat on her own. So the doctor said. And now she bosses me around and drives me crazy. Boy, were we wrong. Never underestimate a girl. Then here I came 21 months later, becoming Alex's best friend, protector, and soulmate. I had fewer issues than Alex, but basically I've always been the perfect child, right? Then life got rougher. In 2001, Alex went to the ICU at the age of 5, almost in heart failure, and finally then got diagnosed with Fanconi anemia. The doctors pointed to me as I was swinging off of her IV pole and said, well, if she has it, he probably does too. We shared everything, even a rare disease. Our only hope was a bone marrow transplant, and our chances were not good. We had to find not 1, but 2 perfectly matched, unrelated donors. 2 lives had to be saved. And when you face the life and the death of disease, there is no future and there is no past. There is only the now. Mom and Dad gave up everything, learning to take life 1 painful step at a time. It was overwhelming. 1 transplant in the family. Okay, but twice? Are you crazy? We shared our story everywhere around the world and had over 4,000 people at our very first bone marrow drive in St. Louis. Ann Curry even did a piece on the Today Show. There were drives all over the world in honor of Alex and me for the next 5 years, adding over 100,000 new donors to the National Marrow Donor Program. And we've heard from hundreds of matches for others, saving lives since then. It was incredible. It was faith, family, and friends. Alex's transplant was extremely difficult 20 years ago. We lost her 3 times, and she went temporarily blind from a stroke. Her chances for survival at the time were only 17%. Then we never found a perfect match for me, and I went to transplant Minneapolis, June of 2006. I was giving myself shots to stay alive and blood transfusions every other day. I almost died 3 times as well, and this was by far our family's toughest year yet. We lived in the hospital most of 2006 and a Ronald McDonald House. Mom and Dad had no jobs, stressed beyond belief, living on a high-level pediatric transplant floor 24/7. They watched gurneys wheel out with grieving parents walking behind lost children. I took a turn for the worse, and my room instantly became ICU. I was intubated and feared they would read my last rites. My mom asked for praise music and some time to pray. My bed was elevated really high so they could reach all the tubes and machines. The room was bright and beeping, machines everywhere. This went on for over 14 hours, and they said they needed to pull the life support. I opened my eyes, and the nurses started screaming. I wanted the tube out. I smiled at Mom. She was crying. I stared at her and I said, "Wow, Mom, you look terrible." She tried to explain through sobs of joy what went on all night. I said, no, Mom, you look terrible. Seriously, go look in the mirror. And I heard her scream as she looked at her hair, and she had a gray streak down the middle of her head overnight from the trauma. Transplant was a wild ride. I had my own morphine pump for the pain and Marinol, a pill form of marijuana to make me have the munchies. I hallucinated surfing on purple alligators and thinking I was drinking Dr. Pepper. I had a tube for food for over 9 months. I did not leave the bed. I did not leave the hospital for over 100 days straight. And even after a successful transplant, the average age for Fanconi anemia is only 33 due to the toxicity levels of the chemotherapy and radiation. Now, we're likely to face cancer next. Alex faced cancer in 2008, but is monitored and doing well. We believe in miracles. We always have hope. We think of hope as hold on, pain ends. So because of FA and disabilities, I have learned so much. I'm a better son, brother, and true friend to many. I hope to give back much more with a college major in public speaking, psychology, sign language, and nonprofit leadership. I want to travel the world and reach millions. FA makes me stay strong, stay focused, and stay calm. If you look at it, the word impossible actually says I'm possible. Miracles remind me every day how to live and appreciate life. Quality, not quantity. I know how to make smart choices. Think about it. When life stops you, it may just be a new beginning. Sometimes the things we can't change, like disease, disabilities, end up changing us for the better if we have the courage to let them. I have learned that life definitely gives us problems, but life does provide people and opportunity for solutions, like Nord. So if there's one thing to remember from my story today, it's this: rare is okay. Don't ever be afraid to be rare. And I will leave you with my two favorite quotes as I draw this white crayon a little closer. My first one here: blessed are the weird people, the poets, the misfits, the artists, the writers and music makers, the dreamers and the outsiders, even those with rare diseases, for they force us to see the world differently. So you're probably wondering why I have this giant white crayon next to me. Think about it. Be the white crayon. It's the crayon that never gets used, the sharpest one in the box, the one that never gets picked, never touched. But one day, the white crayon will stand out because you will learn that all you ever needed was black paper. So, dare to be rare. Thank you. And with that, I will introduce our next speaker here, my mom, Diane Pearl, caregiver to me and my sister. I will pull hers up. Okay, all you.
Hi, everybody. Thanks, Matt. It's always heartfelt for me to hear you speak. My name is Diane Pearl, and I am the mother of not one, but two young adults with a rare disease. Matt told you a lot of our story, and I'm honored to share what I have learned as a mother and a caregiver over the past 25 years. I feel we were all better people when we look at the world through a child's eyes, especially a child with a rare disease. They only want another day, a chance to live and dream, your undivided attention and your time. They want guidance, not gifts, quality, not quantity, like Matt said, memories, not money, solutions, not judgment, and mostly they just want comfort from this pain. When people ask me how I cope, I answer pretty simply: I don't. We live in constant survival mode, like it's 9/11 24/7, fighting a terrorist called Fanconi anemia who uses very unfair weapons. I've huddled in fetal position and screamed. I've climbed a tree in the winter and would not come down. I've driven down a one-way street in sheer panic the wrong way, so overdone I was unable to think. I have sadly met too many medical professionals unaware of Fanconi anemia and have been very frustrated. I've had insurance deny procedures that cost a fortune, and I've written countless appeals that fall on deaf ears. I constantly stay on guard for signs and symptoms of complications and am current with protocols, appointments, and new procedures. Caretaking pretty much has been my life. We moved to Utah in January of 2019. The good news Matt gives us was he proudly announced his job with the National Ability Center. But the bad news was he could not afford to live in Park City. So what as good parents do? We decided to pack up, pick up, and move to support his passion for making a difference with individuals who have disabilities. This meant we had to start all over with doctors and leave our vast support network. We are still building our FA team, but I must say Utah doctors have just been remarkable. Starting over and explaining FA, I usually ask people to think about this question. What would you do if it were you or your child? Wouldn't you do everything possible to save their life? Look for every resource available? Travel to whatever institution is best? Of course, and help your kids to find their passion in life. Give them courage and willpower, however difficult another surgery, stick, or hospitalization is going to be. To me, the biggest disability in life is the inability to really see a person for not only who they are, but who they can be. Watching them fear they are different is heartbreaking. Being too frightened or unaware to reach out for help is a tragedy. I can't wait until tomorrow. and I don't ever sweat the small stuff. I've learned those lessons the hard way. But no matter how bad it is or how bad it gets, tell yourself, I'm going to make it. Believe, give yourself a break, and by all means, eat the chocolate. I've drug cookies out of the trash can before because I deserved it. Teach kids the meaning in life is to find their gift, and the purpose in life is to give that gift away. We tell Alex and Matt to do what makes them happy. We taught them to be kind and passionate. We sent them to special camps in the summer to be with others like them. We all live life knowing it could be cut short every single day. And walking the rare disease tightrope every single day is very scary. I won't lie. But I still have to repeat to myself, because they say, if you say things 3 things, your brain adapts, and the positive is important. So I say, no matter how bad it is or how bad it gets, we're going to make it. Family, friends, and doctors urge all caregivers to take care of themselves, which it's great advice, but I honestly haven't figured out how to do that or what that looks like. I do know, though, how to ask for help, gather a support group, and I'm trying to pass on medical responsibilities to Alex and Matt as they are ready. Their lives, doctors, dates, and appointments are on one giant spreadsheet to keep track and control this disease. And organizations like NORD are out there to help us all. But giving up that control is hard. It's a lifelong process of failing, falling, and planning an unknown future that constantly changes. Being a caregiver does fill my heart, and I am determined and devoted, as Matt said, to put purpose to this pain. Yes, these diseases are rare and challenging, but compassion for those who have and care for them doesn't have to be. I urge you to make a difference and care for the rare. Thank you very much. Here's Matt.
Thank you. Thanks, Mom. All right. Thank you. So as we continue, I now would like to introduce, this will be a video from Jenny Vager, a genetic counselor out of the Huntsman Cancer Institute at the U of U. So sit back and enjoy about a 10-minute presentation from Jenny.
Hi, everybody. My name is Jenny Vager. I am a genetic counselor with the Family Cancer Assessment Clinic at Huntsman Cancer Institute. I am here today to talk a little bit about improving access to rare disease specialists, specifically in the realm of cancer predisposition management. I feel pretty strongly about this topic because I see quite a few patients because of their personal histories of cancer, or their family histories. I'll order genetic testing to diagnose a cancer predisposition syndrome. And then as a provider, I discuss risks to develop cancer. And as a genetic counselor, part of what my job is to kind of interpret screening recommendations and make sure that the patient understands their risks and a plan for cancer risk reduction or surveillance. That said, I think that there is a barrier between people who need to access high-risk cancer clinics, as well as a barrier to accessing some of the screening recommendations. I think that we, as a whole, genetic counselors and as healthcare providers, have done a great job improving access to genetic testing. Genetic testing costs are constantly decreasing. Most people can get a pretty large genetic test for about $250 out of pocket. But now I think that we should, really transition our focus to figuring out how we can get patients into high-risk clinics for cancer predisposition management. So that's kind of where I'm going to go in this talk. I'd like to talk about some cancer predisposition syndromes, give an example, and then talk about why I see these barriers and how we can work together to improve them or reduce them. So cancer predisposition syndromes actually occur pretty frequently. So we can see as many as 1 in 200 people having a cancer predisposition to, as infrequently as 1 in a million, or even less commonly. We often talk about hereditary breast and ovarian cancer syndrome due to BRCA1 and 2 mutations, as well as Lynch syndrome. And there are rarer inherited bone marrow failure syndromes that we'll test for, like Fanconi anemia and telomere biology disorders. But regardless, they make up this whole group of diseases called cancer predisposition syndromes. These syndromes increase your risk to develop cancer. So once a diagnosis is made, we are truly transitioning away from that diagnosis into a realm of cancer prevention and surveillance. As a genetic counselor, I try to fill the role of, putting all of this information together about, what the patient's psychosocial needs are, what their needs are for coordination, especially out here in the Intermountain West. People are coming from far away to have screening done, as well as, the costs for patients and whether insurance is going to cover it. And then, we're kind of also keeping in mind of people's quality of life, is this cancer syndrome affecting their everyday life, and how can we improve that? Many of these syndromes are managed best in high-risk clinics. So high-risk clinics are what we're going to be talking about most in this presentation. And as I've mentioned already, there are significant barriers to accessing these high-risk clinics. At Huntsman, we have several high-risk management clinics. On the left here is just a real brief list of some of the cancers that are seen in each of these clinics. And then on the right is this diagram of how we as providers all work together to manage a patient with a cancer predisposition syndrome. So we have a specialist physician who staffs these clinics and a nurse who helps to coordinate. We have a genetic counselor who specializes in the clinic as well, a psychologist who works in some of our clinics, not all of them, but is available for any of our patients. And then we also have schedulers that are, really integral to making sure the patient gets into our clinics. This list is by no means exhaustive because there are still many other providers that make up our team, including radiologists or pathologists. So this is just a small slice, but this is the core group of what makes high-risk management so successful in a multidisciplinary clinic. An example of a hereditary cancer predisposition syndrome is Li-Fraumeni syndrome. Li-Fraumeni is caused by disease-causing mutations in the TP53 gene. Classically, we see risk to develop cancer at a very young age, and we'll see maybe multiple cancers developing in the same person. Classically, we also see very high risks to develop cancer in a lifetime, so approaching 100% in women and 70% in men. Though non-classically, we've also identified many families that suggest that there's more of a spectrum of risk in LFS. The cancers that we typically see are, brain tumors and breast cancers, sarcomas, lung cancers, childhood cancers. So on the right here is a family that looks pretty classic for LFS. And screening ultimately starts the day of diagnosis and continues throughout life. So, what can we do about screening for LFS? We are able to offer a approach to screening that looks at these areas of the body that we know are going to be affected. So screening does start in childhood, often at birth when we find out that the child has Li-Fraumeni. It consists of an annual whole body MRI, which at our institution is an MRI from the base of the skull to the pelvis and includes the arms and legs. It also includes a brain MRI, an annual brain MRI. It includes annual imaging in females with LFS starting at the age of 20. It includes annual or regular upper endoscopies and colonoscopies starting at 25, and then annual dermatology exams starting at 18. So, for a 25-year-old woman, we would be doing an annual whole body MRI, annual brain MRI, annual mammogram, annual breast MRI, annual dermatology, and then regular upper and lower endoscopies. So that can be pretty laborious for patients to manage by themselves. But, screening does work. So cancers that are detected by screening have better outcomes than those identified because of symptoms. And screening is cost effective. So these are often, arguments that we make for insurance to cover screening and to cover our high-risk clinic. That being said, we still have barriers to getting patients into clinic. And it's not just, patients with Li-Fraumeni, it's other patients as well. One of the major barriers that I see quite often is insurance, meaning that there's a lack of coverage for the clinic or limited coverage. As a clinic that has managed high-risk patients for over a decade, insurance can still say that we are not in network with their insurance and they should go see an in-network provider with none of this specialized management or experience. Or, the patient doesn't have out-of-network benefits and we are an out-of-network clinic. Another barrier that we run into is similarly, when insurance can dictate whether the screening is done at an in-network facility or an out-of-network facility. And so we can see, patients having problems coming to Huntsman to have a whole body MRI when we're the only facility in the state that offers that. So, classically, when we talk about problems in Utah, we have this divide between Intermountain and the University of Utah, and how insurance like Select Health doesn't cover the University of Utah unless there is a cancer diagnosis. And in cancer predisposition, we are trying to avoid that. So it's a little bit of a double-edged sword. And then I've listed some other barriers that I see, like telemedicine, and telemedicine not being as widely used, though it can really increase access by decreasing the need to travel and pay for traveling. Licensure, having better licensure laws that cover the surrounding states would be super helpful. And then, genetic discrimination. So even though there are federal laws that protect persons with genetic conditions from insurance and health insurance discrimination, state laws can be improved to avoid further discrimination, like for discrimination when it comes to life insurance. And that, in itself is going to help patients feel more at ease getting genetic testing. As far as eliminating barriers to medical care, I struggle with this because I don't have all of the answers. But socially distanced, I think that we can, work together to reduce these medical barriers. And I would really love to hear from your group as to, how we can accomplish this. So thank you so much for listening today, and thank you for inviting me to speak. If you have any questions or if you have any ideas, then please feel free to get in touch with me via email. Thank you so much.
Perfect. So thank you to Jenny. Go ahead, Matt. Sorry.
You're good. That was great. I'm glad she was able to do that for us. So next we have Denise Bell, and Denise is the Vice President of Programming and Governmental Affairs with BioUtah. So Denise, I'd invite you to unmute yourself and share.
You should. Okay, getting there. Okay. Well, good afternoon, everyone, and thank you, Matt. On behalf of BioUtah and our life science companies, I just really want to say that we're really pleased to be part of the Utah Rare Disease Day. I think it's so important to have these conversations I want to thank Matt Pearl, our state ambassador, his mom, and the NORD team for all their hard work and for bringing us together. Matt, I was so touched by your story. I think it says it all, why we're here and why we need to be here throughout the year, not just on, Rare Disease Day. And NORD, thank you for all your wonderful resources. Been so very, very helpful. Much appreciated. A little about BioUtah. We're the only state trade association dedicated solely to all segments of Utah's life sciences industry, which includes companies working in diagnostics, biotech, and medtech, all focused on innovating products and therapies to improve and save lives. I'm going to talk a bit about the creation of the Utah Rare Disease Advisory Council, where things stand with that and next steps. I know Elise provided some initial background in her slides, but just to kind of recap for those of you who are not familiar with our RDAC journey here, during the 2020 Utah legislative session, both the House and Senate overwhelmingly approved HB 106, which was sponsored by Representative Li-Fraumeni and Senator Luz Escamilla. I know that they wanted to be here today, but I understand that schedules didn't align. So I just want to convey how grateful we are to Representative Perry and Senator Escamilla for their leadership. And I know that Representative Perry has actually since left the legislature, but they were our champions, and we really appreciate all their hard work. Elise also mentioned that the legislation did provide for an appropriation of $9,500. This funding actually envisioned leveraging the resources of a nonprofit partner like BioUtah to help with the heavy lifting, to convene the council, and provide administrative support at no cost. And BioUtah has offered that to the Department of Health. Under the legislation, our RDAC would be housed under Utah's Department of Health. Responsibilities of the RDAC include advising the legislature and state agencies on providing services and care to individuals with rare disease, and to make recommendations on improving access to treatment and services. We're very excited about moving forward. Last year, as Elise said, when COVID-19 hit, we were kind of stopped in our tracks for a bit because our funding was rescinded as part of budget cuts that the legislature made in June. But fortunately, there continues to be a lot of support for the council in the legislature. So our funding was recently restored in the state's base budget, which was signed by Governor Cox. So it's a done deal. We have our funding back. And thank you all, for supporting this effort. I think it really made a difference. So, now I think we can begin to look ahead in terms of, what we need to do to get the council off the ground. I think a couple of things we'll need to keep in mind is that the RDAC is housed under the Department of Health, and under the legislation, the department is technically tasked with identifying the council members. However, part of the discussions that we had with the sponsors in getting the bill passed was that BioUtah would do a lot of work to support the department. This is a real priority for us. You have our commitment. Our organization is behind this 150%. And we're committed to working in collaboration with the entire Utah rare disease community and stakeholders as we get this off the ground. This is a collective effort. So we think we can start the ball rolling by being proactive and, again, working together with the community to identify potential members of the council. I think that's our first step. And then bringing that list to the Department of Health. We're going to have to be a little patient because the department is still laser focused on COVID-19 and vaccine distribution. I think, that's understandable. So we're going to have to wait for the COVID situation to ease a bit before we can get their full attention. they will have final say on appointments. However, again, I think in the meantime, we're thinking that we need to be proactive in helping them identify these individuals, bringing it before them, and get things started that way. So I really think we can begin to explore with the broader Utah rare disease community who would be, good candidates for the council. Realistically, it could probably be the end of this year, even early next year, before we can actually formally, convene a meeting. Again, I think COVID-19 has slowed the process down somewhat, but we really are, dedicated to making this happen and making a difference for patients with rare disease. So we're excited. We're looking forward to working with all of you, and so let's be in touch. And I'm happy to answer any questions. Elise, I think you have my contact information, which I hope you can share with everyone on the call today.
Absolutely. And feel free, if you're comfortable, Denise, if you would like to put it in the chat, you're welcome to do that as well. And I can go out to everyone.
Happy to do that.
Yes, thank you, Denise. That was awesome. Let me know if you ever need help. I'd love to.
We want this to be we want this to be a collective team effort, and there's so much expertise and experience, that you have, that we'll need to, to bring into this effort.
That would be awesome. Okay. So as we continue to keep rolling today, I'm encouraging everyone, as the slide hopefully in front of you says, to grab that piece of paper and think of the word rare. And as you think of that word rare, what comes to mind? Looking for basically one word that might go on in your head when you think rare. What is rare to you? And to me, I'll hold up my word is resilient. And after you've written your word, if you could hold it up so that others can see it even more as well.
I don't know. Can people see it?
Sometimes the closer if you put it, the better.
Treasured. Yeah, I can see that.
There we go.
I didn't write mine real pretty. It's exceptional.
Awesome. All right, thank you guys. That's awesome. Treasured, resilient, exceptional, courage, strength, strong, lots and lots of good words, strong words. All right, so before we move on to some of our very final housekeeping things, does anybody who's on today have any questions or comments that they would like to share?
This is Kristen from NORD. I just want to give a shout out to Matt and thank you for coordinating such a great event today. And thank you to all those that shared. It was a very inspiring day, and I hope that these conversations continue and the work continues here in Utah, working towards, improving the quality of life of patients and their family members. I think we learned today that, there's a larger group impacted by rare disease, and, it's important to participate in events like this. It's important, you know, to keep active. And I just encourage you all on the line today to get connected to Matt. I did put his contact information in the chat, and I can pop it in there again. And, you know, help build this rare community in Utah. And we'll continue these efforts. So thank you, Matt, for helping out today and doing a great job.
Yes, thank you, everybody. And I look forward to hopefully getting to be able to do this in person even next year.
And I know somebody just asked in the chat how you can get connected. So I'm happy to pop your info in there once more. But I also, if you're not signed up for the Rare Action Network, I encourage you to go to rareaction.org and join, and you'll get notification. Oops, that was the wrong link I just put in there. Hang on, that's the correct one. And if you can also connect directly with Matt, and you know, we've got, this is just a stepping stone. This event is kicking off our year. So we're hoping to have some more virtual events in the coming months. And we're also, you know, looking for ideas from the community as ways to stay engaged and connect with other Rare community members.
Awesome. So as we're looking at in front of us, all this cool Nord swag, the mask and the socks and the zebra, the water bottle, what we're doing, it was a little tricky to figure out, but basically after the event, we will be randomly selecting 2 winners from the attendee list to receive these Rare Disease Day swag bags. And the winners will be contacted by email this week and hopefully receive their prize sometime around mid-March. So we thank you again for being here and wish you much, much luck to get these items. And again, here's some of my info. It was just sent in the chat. Thank you, Kristen, for doing that. My passion is to help others and make a difference in the world. So any other resources or anything, my email is here. You can contact me through my phone or email directly. We want to thank everybody for being out here today, and we have one more video we would like to share with you.
Thank you again, Matt, for a wonderful event. Let me play our last video here today.
Every year on the last day of February, the National Organization for Rare Disorders joins together with others around the world to raise awareness of the challenges faced by people living with rare diseases. Achieving health equity is even more difficult for rare patients. To have equity in health means everyone has an opportunity to be as healthy as possible, regardless of social, geographic, economic, or other obstacles that may be working against them. At NORD, we appreciate your support, which allows us to work on issues like health equity and many others, and for our staff and volunteers to bring them to the forefront on Rare Disease Day.
From the volunteer state ambassadors, we would like to say thank you to all of our Rare Action Network supporters for helping us connect with rare patients and families in our states.
And thank you for allowing the Rare Action Network to raise important issues with state lawmakers on Rare Disease Day and throughout the year.
Did you know that in medical school I was told when you hear hoofbeats, think horses, not zebras? But what about the more than 25 million Americans living with a rare disease? At NORD, we are humbled to provide help and resources to our zebras and their caregivers.
NORD support allowed me to catch up on some overdue bills, including my rent. Thank you for your support, NORD, and thank you for supporting Rare Disease Day.
From all of us at NORD, thank you for your dedication to the rare disease community on Rare Disease Day and every day.
All right. Well, thank you so much, everyone, for joining us today. It was wonderful to have everyone's participation, and thanks again to Matt for putting this all together.
Yes, thank you everybody for being here.
Take care.
Bye.